winner of the Paludanus Prize 2008, the cardio stick project from the MUMC, the Maastricht University Medical Center.
Right, we'll take this mask off. If you'll put your tongue up, that's it, right there. 45 minutes long, heavy pain in the chest. We've detected an attack in the anterior wall. I've rung them. They're all ready to receive you.
Heart problems, the most common life-threatening disorder in our Western world. Several hundred people with heart problems are transported by ambulance to emergency departments per day.
Bed vrij?
Ja, los.
Ready to go. Cardiology, right? RDCX. Yes. Okay, that for today?
Yeah.
Medical care in Holland is of an exceptionally high standard. Heart surgery is part of the daily routine in most large hospitals. With the knowledge we have these days, the number of patients who recover completely after a heart operation has increased considerably. But for the patient, there is of course another side to an intervention of this kind. It has a huge impact, not only physically, but also psychologically.
Good morning. Good morning. Come this way, please.
The specialists have done their work, and the patient is having his provisionally final appointment with the cardiologist. The MUMC has developed a unique aid for its heart patients, the cardio stick, a support in what has for them become an uncertain future.
And now, finally, I'm going to give you something from this institute, and it's a USB stick. The stick has all your medical data on it, your date of birth.
The cardio stick is a USB stick in the form of a credit card. The stick will start up automatically in any Windows computer anywhere in the world. For the emergency page, no password or login code is necessary. On the emergency page, you'll find the patient's personal details and his blood group, the kind of heart operation he's had, his medication and dosage, general health status, and allergies. The stick is multilingual, with Dutch, German, French, and English. There's an ICD or pacemaker registration, an arrhythmia diary, the ECGs and operation reports can be called up, the ICD or pacemaker data can be called up, and backing all this up is a secured medical dossier that can only be opened with a patient's password. The stick is provided with clear instructions. At this point, more than 500 patients in the Maastricht area possess one of these sticks.
Good afternoon.
Good afternoon.
So what's going on?
I'm so short of breath, as if a weight's on my chest.
The emergency services in the area are familiar with the stick by now, with radically positive results.
Let's have a look. There you go.
Dat is een stick wat je voorstelt.
Thank you. Now, Mrs. Buurfry, we've got a heart film. I see you've got an irregular heart rhythm. We'll compare it with the data with your stick. I'll be right with you. Right, I've checked your details with the ones on your stick, and this heart film with the irregular rhythm is completely normal for you. You knew that. As far as we're concerned, you don't need to go to hospital.
Oh, good.
Relief, eh? We could check it with the details on the stick, which is perfect.
I'm happy about this. I'm really happy with that stick.
Normally you'd have to come with us with this reading, but because we can compare it with your stick, you don't.
GPs in the area are used to the stick. As it's compatible with their information system, adding information to it takes no more than a couple of clicks on the mouse.
So, that's done. You see? There you are.
Data from chemists' information systems can be entered just as easily.
I'll just put it all down for you. One moment, please. So, it's all there now.
Alles klaar?
Yep.
Dank u wel.
All complete. You're free to go.
Bye.
Bye.
With the cardio stick, the life of heart patients has now changed. Having their medical details on them gives considerably less mental stress. Anywhere, both at home and abroad, all relevant medical details are now directly available. This means that both patients and their partners can lead as normal a life as possible.
And finally, of course, we had the acute patient group who presented at the emergency room. These people were very ill and therefore unable to give us much information, so we had to ring round the various hospitals to track down the patient's medical records and get them. But apart from that, of course, heart patients too are often no longer able to communicate when they come to us at emergency. And in emergency situations, time, knowledge and skill play a crucial role, and any delay can worsen the outcome for the patient. Now, the advantage is that the cardio stick is a mobile patient dossier, so any caregiver can use it, and this isn't limited to Holland alone, but all over the world. And I'm thinking here of GPs, of course, but physiotherapists, rehabilitation specialists. Now, there's very little communication between hospital doctors and rehab specialists, and in the future this will play an increasingly important role because heart patients are getting younger. And we expect in the future that there will be more and more heart patients. So not only GPs can use it, but hospital specialists, as I mentioned before, second opinions, and in emergency situations, but also outpatients, cardiologists. So the communication between the various health workers is going to be simplified. People who have had a heart attack or other heart complaint, we know they often develop psychological problems, and particularly depression or anxiety symptoms. This can vary from light symptoms to your real serious depression or anxiety disorders. And this wasn't known in the old days, but today we've done a lot of research into the matter, and we see that 1 in 3, 1 in 4 patients indeed develop psychological problems. And as you can imagine, for the patient in question, it's not pleasant and reduces his quality of life.
The cardio stick is ongeveer
The cardio stick arrived 1.5 years, a year to 1.5 years after my operation. What it changed for me is that when I was operated on, I was a bit afraid of getting on a plane to go on holiday. Motorbikes are a bit of a hobby with me. Not that safe, and I'm afraid if something happens with the anticoagulants you have to take or with the other medication. It's given me a level of security. If something happens abroad, for instance, well, I don't speak the language and definitely not enough to explain what's wrong. And the beauty of the cardio stick is that in various languages you can see what's wrong with the guy. So for me it's, I'm better off. It's reassuring.
Yes, it's a very reassuring feeling, especially as I've got this important gadget with me that I can hand over at any time that the doctors are going to find really useful. So if we go away for a weekend or go away on holiday, then it's just a reassuring feeling.
We zijn een weekendje weggegaan.
We went away for the weekend, just here in Holland by the sea. And you're away and nowhere near the hospital, where the people know you. And I forgot to take it, and, well, that was a strange feeling. I do feel more at ease if I've got the stick with me. So if something happens, they can plug it in and see straight away. So that's what the lad's got, and we can help him.
Yes, research has been done, and we know that with heart problems, for instance a heart attack, that you've got more chance of getting depression or anxiety disorders. And vice versa, once you have depression or anxiety, you have more chance of having another heart attack or heart arrhythmia or other problems. And it's also true that people who've never had a heart problem but are depressed or anxious, have more chance of developing a heart disease. So the link is there. How it works exactly we don't know yet. There's research still to be done, but there are a number of biological processes that we already know, and We think that they're related, probably.
Ik ben heel blij.
I'm really happy that we've got it. It just gives me a sense of security. It's what I said before. I always thought, shouldn't I carry a letter with me? My father, for example, had exactly the same operation. He always wore a chain with some of his medical details on it. Yeah, it wasn't much. You can't fit much information on it. But it gave him, well, reassurance. He felt much safer with it. And I have that with the cardio stick. There's much more information on it, in various languages. He didn't have that. But when I got it, he immediately asked how he could get one. And yeah, it's just a feeling of security. Yeah.